Welcome to Facts Friday. I'm Kelly Lenvoy from Arthritis Consumer Experts, and we're pleased to be able to provide you facts about arthritis from some of Canada's leading experts direct to you at your home. That's obviously so important now as patients are looking for the latest real-time data and science as it relates to the COVID-19 virus. We're very pleased to have with us today Dr. Shahin Jamal, rheumatologist in the Department of Medicine, Division of Rheumatology at Vancouver Coastal Health, and clinical associate professor at the University of British Columbia and program director of adult rheumatology. Dr. Shahin is one of Canada's leading investigators in the diagnosis and prognosis of early inflammatory arthritis and the timely assessment and access to care for patients with inflammatory arthritis. Dr. Shahin, thanks so much for joining us on Facts Friday. And I guess the first question is just how are you doing right now in the midst of this pandemic?
Yes, thank you. Thanks for having me. It's nice to be here. And yeah, it's crazy times, that's for sure. This is something that none of us have experienced. And, first and foremost, I think we have to realize that we're lucky that we live in this country and that we have, the worst thing is that we're stuck at home with our homes, with our families, and we have technology so that we can still stay in touch. It has been busy with the kids at home. They're now going to school from home on Zoom, and patient care is happening from home. So big changes societally.
Well, I certainly want to thank you and all of your colleagues on behalf of our patient community for the incredible work and sacrifice that all of you are doing currently. It's truly, truly appreciated. And I hope the 7 o'clock ceremony now every evening is giving you some of that sign of support.
Thank you. Yes, I think it's amazing how everybody's rallying together, whether it's healthcare professionals, people in the community, and people that work in other jobs which are sustaining our community too. All the people who are delivering essential services, whether it's gas stations, stores, delivery people. We're all kind of playing a role. And I think, in terms of healthcare professionals, I think it's everybody. It's the cleaners. It's the, from the cleaners all the way till the critical care staff. So thank you.
One of the first facts that our community has been asking us, our members across the country, is just how is this pandemic affecting the care and treatment that people living with inflammatory arthritis are receiving? Can you share with us what you're seeing, experiencing on the front line?
Yeah, so that's a great question. And I mean, I think that probably the biggest change that we've seen is this shift from in-person visits and care to online and telephone care and visits. And I think for many people, that's actually been quite welcome. And perhaps after this whole thing is over, we'll continue to deliver our care like this because it is convenient, and I think we're discovering how much we can actually evaluate people on a video screen, and maybe we don't need such face-to-face. I think the downside is we don't get to examine patients, and you also lose a little bit of the clinical connection. And the other place that's perhaps been impacted is for joint injections. We're not able to do those. So it's really quite, particular about who and how we're going to get people's joints injected. And also those people who get infusion medications, because a lot of infusion clinics are closed and hospitals are not letting people infuse. So those are the big challenges. The third is blood work. Patients are afraid to go to the lab. Patients are afraid to go for other investigations. But again, I think we're learning that perhaps we can get away without doing so much investigation, and we're still able to provide hopefully good clinical care.
Certainly one of the questions that we're receiving every day at ACE is from patients who are wondering about their current medication regime and if they should be continuing to take those medications or considering stopping. I'm wondering what your perspective is on that.
I mean, I think as a whole, our rheumatology community understands that people are on medication, immunosuppressive medication, for a reason. Patients are prescribed medications because they have a chronic autoimmune disease. And these medications, for the most part, are hopefully helping to control that autoimmune disease. So we want people to stay on their medications as much as they can. On that token, I think what we've also seen around the world, experience in Spain and Italy, even in the US, there was a recent paper published from Seattle or Washington State, and they looked at cases of people who had a bad outcome with COVID. And actually, none of our patients who are immunosuppressed seem to have, doesn't seem to be its own independent risk factor. So although patients are concerned that these medicines that suppress their immune system put them at risk when they get COVID, that might not necessarily be the case. And that's what we're seeing just looking at observed populations. Is that because people who are immunosuppressed are that much more conscious and are social isolating and hand washing and preventing getting COVID? Or is that because maybe our medications help to protect the immune response that, with COVID, people getting really sick, it's an autoimmune thing. It's not the virus itself, it's the immune system responding to the virus. And maybe our medications might even protect from that. It's hard to know. We don't know. And this is something that's all sort of being looked at and explored in terms of trials. I would recommend continuing your medication because it's helping your underlying disease. And having a flare of your underlying disease would just complicate things.
When patients are listening to the news or searching on the internet, they're hearing a lot about the older population being at risk and more vulnerable.
Mm-hmm.
Is that accurate, or should younger people be concerned as well?
I mean, I think everyone should be concerned. In general, the risk of having a bad outcome, needing ICU, needing intubation, ventilation, and even mortality is higher in older people. That said, there are also reports of younger people getting sick. And so, we can't identify who's at risk and who is not. In general, it seems to be older people, but I don't think that younger people are, not at risk. They're just less at risk.
One of the objectives on Facts Friday is to debunk the myths that are circulating in society right now, whether you're searching on the internet or talking to your friends and family or peers. I'm wondering if there is one consistent question, one persistent myth that you're confronted with in your practice, and maybe you can help clarify the facts behind that myth.
So, I mean, the consistent questions that I'm getting, we've already addressed one of them, and that is whether people should stop their immunosuppressive medication. And from, again, from what we know so far, there's no reason to stop immunosuppressive medication. The other thing that is a consistent worry for patients is this hydroxychloroquine issue. As people who might follow the American news, there's a lot of discussion in the American media and with the president about the use of hydroxychloroquine in COVID. Now, again, that's still being investigated. It's not mainstream treatment. However, many people are starting to use hydroxychloroquine and chloroquine. And so patients who require hydroxychloroquine for their autoimmune disease are often worried about a lack of or shortage of supply. So far, we've been assured, the CRA, Canadian Rheumatology Association, and various other bodies are working really hard to advocate for patients to ensure that we have enough supply for rheumatology patients. And also, we've been assured by Novartis and others that there's a high ramp up of production. So I've been reassuring my patients, I don't think anybody needs to stockpile medication. And even if, for whatever reason, you have to not take hydroxychloroquine for a week or 2 weeks or 3 weeks, it's probably not the end of the world because it is a long-acting medication. It stays in your system for a long time. So that's sort of the one of the main concerns that patients are expressing is this potential for shortage of hydroxychloroquine. And hopefully our society won't be hoarding, and hopefully there'll be enough to go around for everyone who needs it.
To underline that, we still don't have the scientific evidence that is effective to treat COVID-19.
That's right. That's right. And it's under investigation, so it's not a mainstream treatment for COVID-19, most definitely for sure.
Well, thank you for those facts, Dr. Jamal.
You're welcome.
Very, very helpful for our audience. And we want to thank you again for taking the time from, we know must be a hectic day, a hectic week for you. And thank you again for your efforts and all of the people that you're working with. We truly appreciate the the sacrifice that you're making and the work that you're doing to help patients across Canada.